Hi, Brian and Mark coming here for Fitness4Life
Or Mark and Brian.
And
Either way.
we got exercise number 2 for your knee replacement. So we worked on straightening, now we got to work on bending.
So especially if you've got limited range with the bend, we want to try to get as much of that back as we can also for post-surgery. So a good way to do it at home is just sit in a chair. Now because we're on carpet, we've got just a furniture slider. We're going to put your foot on it. Now, sitting there, you're going to get as much bend as you can. A lot of the people we see can't even get it anywhere near as far as Brian has it now. They may come to us, or they may be starting somewhere here. What you want to do is you want to sit here, put a little bit of stress on it, so pulling it back with your other leg to where you get a mild pull. This is not no pain, no gain, so you're not trying to see how hard you can pull it back. Because remember, you have to be relaxed and let the tissues relax so they can sink into that stretch. In essence, you're giving your brain permission to say, I need and I want to go there, so it's okay, you can relax. You push too hard, your brain takes that as a signal that you're going to hurt yourself, and it tries to shut everything down, lock it down, and it makes it much harder to stretch. So, bending it like this, sliding it back, we recommend about anywhere between a 1 and 3 level pain if 10 would be your worst, but being able to breathe into it, and just like the last one where you were straightening it, if it's pulling too hard and you can't relax, you're going too far, so you back it off a little bit. So you have to play on that edge of how much range you have and get into that a little bit, but not too much. Again, 30 minutes total time is good, okay? Now, if this doesn't work as well for you, another thing you can do is you can go and lay down. So come over here, just follow him, and lay down with your feet over here. Feet over here, yeah. And what you can do then is slide up, bend your knee and put it up on a wall. Now this isn't a very good wall, but you can put it here and just let your leg slide down that wall and hold it there. This would be more recommended if you have a very limited knee bend, but it's another option. So you'd be on a smooth wall here, and you'd just be laying like this comfortably, letting gravity pull down on that. Holding it for time, being as relaxed as you can. So the first one, getting it straight, the second one, getting it bent, goes a long way towards getting you in good position when you have your knee replacement. So again, it's critical. What you do before will really help determine the outcome of what you have after. Further questions, contact me or Brian at Fitness4LifePT.com.